There's like a flipping tape over here that you're supposed to be on top of it, and that's the worst thing ever today. So I'm going to be here. If I move, somebody needs to remind me. So, all right. Well, thanks to Boomtown, our mentors and everyone coming out today. They told me it's going to be fun, so I'm not going to talk about my pitch. It's going to be all fun tonight. So I'm just kidding. All right. 1 out of 3 people in the United States is suffering from chronic pain, either diabetes, arthritis, or some type of cardiac disease, or many more. That is 117 million people in the United States. In fact, probably we have more than 300 people in this very theater right now suffering from chronic pain. But this is not about the numbers. This is about people. And this is why I am here today, to share what we have been doing with my partners, with my team here. Let me tell you a story. This is Nancy. She has rheumatoid arthritis. It's an autoimmune disorder that your body fights with itself, specifically with the joints. It's super painful. She wakes up with it, she goes to bed with it, and the only thing she can do that by managing that with medication. She spends 5,000 hours herself per year to manage that by herself. She's struggling with scheduling appointments with her doctor, and she's taking heavy medication that actually makes a lot of complications and side effects along with it. It's insane. It's insane for her. It's insane for her doctor and clinicians as well. My name is Mehmet. I am the co-founder and CEO of cliexa. What we do, we build platforms for people like Nancy so they can connect with their doctors dynamically with a platform, so we can close that feedback with them, the loop with them, so they can communicate with each other. Let me tell you how it works. It's very simple. Instead of Nancy trying to figure out her medication, trying to schedule an appointment with her doctor to tell how it hurts, all she needs to do is open the app, touch where it hurts. Some people watch me, please, not the naked lady over there. And then what happens is it generates a disease activity score. And that actually sends that information right to her doctor. Instead of Nancy dealing with pain and medication, that information right into her doctor's platform right away. It's huge. It's huge for a doctor, because if I cannot manage her pain until the first appointment coming up in 2 months, that's hard for me. But this gives him the opportunity. So I can respond as a doctor right in time, optimize the treatment and the medication. What happens with that, not only managing the treatment, optimizing it, there's a lot of cost savings. The way it works is, if they use our platform, obviously Nancy is not going to end up at emergency. That will save a lot of money, out-of-pocket cost that's coming out of her pocket. Obviously, her doctor is going to be way more responsive. He's going to use less expensive medication so he can control it earlier. And obviously, insurance companies are going to save a lot of money with preventive care and responsive care at the same time. If you look at the market today, the research says the conversation between doctors and their patients, you can actually save 30 to 60%. Just frequent conversation. There's about $2 trillion that is spent in the United States to be able to manage that conversations for medication, for expenses, just you name it. I'm not even talking about the emergency costs or hospitalizations on top of that. What we're saying, our platform of tools can at least save 10% on top of the 30 to 60% that I just talked about. Well, let's talk about how it works on numbers, right? Like Nancy has rheumatoid arthritis. She costs about $66,000 to our target customers, insurance companies. They pay $66,000 a year for her medical expenses. We're charging them $600 per year for the platform, for chronic care management platform and analytics, which is 10% of the cost savings if we would optimize the system for 10%. A single insurance company would save per year for 5,000 patients only $33 million. This is a lot of money, just with 10% of optimizations. If you look at the projected revenues with this model, starting from 0 patient to just 50,000 patients in the next 5 years, that's what it will look like. By the way, just single disease, that's rheumatoid arthritis. But that's just not even scratching the surface. You know how many people in the United States with rheumatoid arthritis? 1.5 million. If they would be using this platform, this is where it will be at. What we have achieved about like past 5 months, it's amazing. We launched our first app, cliexa RA for rheumatoid arthritis. We actually did one for Crohn's disease and the other one for Google Play Store. And then we ended up with the clinician platform, which is cliexa Track. Just 5 months. What we're looking for is FDA. So that logo is there. Speaking of pain, is the most painful experience I can tell you. Well, I'm here to announce excitingly, I'm really, really excited. Actually, they told me to keep saying that word several times to mention this. May 2016, we have been cleared by FDA for our concept already. Thank you. And for the same concept, which is the evidence-based data indexing decision support concept, we applied for patent. Likely we're getting by the end of this year, hopefully. Thank you. Thank you. Well, I wish that was the only exciting news because I'll be here another couple hours tonight. No, I'm just kidding. Well, seriously, the one of the biggest things that we experience here is, like I said in the beginning, the mentors, and through Boomtown. I am really delighted to say that we're starting a project, a clinical validation project with Colorado Permanente Medical Group for rheumatoid arthritis for 6 months, starting this month. Thank you. Our goal is to work with them for the next 6 months, do data validation, data security, HIPAA compliance, and then integration with them. And hopefully we're starting our exclusive contract early 2017. And then the goal is, again, this was one chronic disease I just talked about, to scale our product into 3 or more chronic diseases by Crohn's disease, ulcerative colitis. Hopefully we're going to start with atrial fibrillation, again working with Colorado and Permanente Medical Group. Healthcare technology I've been talking about. Healthcare and technology. If you need an expertise in both sides, first you start with the right people. We have 3 physicians on board as partners. We started with this journey, and then they're the first people that we met at a party. We said, how about, and then we came here today. And they're the first people, they validated the idea. And let me tell you, if doctor says this will work, that's golden, I'll tell you, between you and me. That's what we started for. They're autoimmunology experts. They've been leading this journey from the beginning. And of course, with that expertise, me, myself, in technology with about 20 years experience and maybe 15 more years on top of that with leadership role. Nate here joined the company with his 20 years of experience in software development. Lance, he has been a health executive for 20 plus years. Haluk, who is actually clicking right over there for me, he's a good clicker. He provides a lot of clicking now. He's a great financial analyst, and we have a great full-stack developer on board. Well, we're not the first ones out there, right? There are a lot of people who are trying to solve the problem. And I'll tell you, There are a lot of people, they were trying to solve this problem in two different ways. One is medical tracking. The other one is chronic care management platforms. A lot of them out there. The differentiator for us is coming here and combine this all together with the mobile applications, chronic care management platforms, and then adding the decision support and learning algorithms on top of that. That's where we are different from our competitors today. And hopefully with the pilot, we're going to probably provide way more value that we have been planning on with different chronic diseases. With that, insurance companies get a lot of things, not only cost savings. They can track the patient compliance. They can track the physician compliance. They can also do chronic care analytics as well. This is huge value on top of what I've just talked about past 11.5 minutes. Now, this journey we started, like I said, almost like 5-6 months ago. I believe we have the right people, and we have been working really hard on that since to this day, till to this day, I will say. Our goal is to help people. We're not trying to come up with a great application that's going to save the world. This is for helping people to have less pain. Our job is to provide better quality of life. We believe we have the right team, and we have the right clicker. Thank you so much.